I came here as a result of leading a national trial in bladder cancer. It turned out the study gave us a lot of information, but it didn't advance the field far enough. But it got me on the road to doing more things. And what I was particularly enthusiastic about from coming here was this was the one place that basically said, tell us what you need, do what you want, and we'll help you. And so I got basically carte blanche permission to start doing these combinations in patients on a compassionate use basis. The ones that looked really good, like the gemdosi, we were able to then consolidate and funnel more patients into it, generate the numbers that we needed to prove to ourselves and to the world that this stuff really works. One of the interesting features about bladder cancer is that it doesn't just go away and stay away. It's one of the most recurrent cancers of all the cancers that there are. For the longest time, everyone was trying to give a single drug. And so they came up with these 3 old drugs, and they caused burning in the bladder, and patients felt like they always had a urinary tract infection, so it was awful. And it didn't work very well. So when BCG came around, it basically took over. And these drugs didn't work well at all if BCG had already been given to the patient. So there was really nothing. And it struck me as in all of medical oncology, no cancer is treated with a single chemotherapy. You just don't do it.
We started using gemcitabine and docetaxel combination chemotherapy in patients who had recurrence after BCG. After we noticed success with that regimen in those patients, we started also using that regimen for patients who didn't have access to BCG due to the BCG shortage. So some of our recent work has been looking at the utility of gemcitabine and docetaxel in patients who have not been treated for their cancer in the past. Dr. O'Donnell's done a lot of work in developing this regimen and getting it to our patients and also spreading the word about it to other places in the country. Some of the work that I'm doing is trying to focus on which patient subsets this regimen works best for, to try to find out if we can predict who the best patients this regimen would be for.
There's a special nature to what we're doing here in that we're looking to the future of bladder cancer treatments. And if we stay in this rut of what we know, there's never any space for imagination, for creativity, to take a chance on something that might change a lot of people's lives.
Being presented with an option to have my bladder and my prostate removed just didn't set well at all. And I agonized over the first 6 weeks with my last doctor when he said, if this doesn't work, we have to look at other alternatives. And when I lost a lot of sleep just trying to get my head around life without a bladder. As time went by with those, Dr. O'Donnell's comments were very pleasing to hear. He liked what he was saying. He says, this is good. I was in last Thursday afternoon. He did an exam and he told me straight up, he said, you are in full and complete remission, which was just music to my ears, our ears. I was just quite taken aback by it.
The first time I met him was probably 15 minutes before I went into surgery. So I came out of it and I was in 6 weeks of chemo. Then I was in 6 weeks later, I went in for another cysto and I had no cancer. And it was like a miracle, a miracle. I think it's so important to get the word out of what he's doing, the impact that what University of Iowa and the urologic area there and Dr. O'Donnell is doing, whatever we can do to try to help increase the impact of what he's doing to bring a better quality of life to the population, the well-being, whether it be in Iowa or Chicago or anywhere else or in the urologic community, is gratifying.
We need to get the word out. We came in with 2 generic drugs. They're not patentable because they've expired. They're cheap. They don't cause any problem in terms of toxicity, or very little, and they're very effective. And people just weren't ready for that. You'd think they would have jumped on it, but no, you've got to literally bang the hammer on their head. I mean, for 3 to 4 years, we couldn't get any of our work published because nobody believed it. And finally, after we got over 100 patients and showed that this is working so well. In fact, we did a multi-institutional trial with almost 300 patients and showed results that were unbelievable, 3 times better than all these expensive drugs. People started to pay attention, but we were still, quote, the elephant in the room. It was being at the right place at the right time and being attuned to the idea of you should be able to use combinations. And because neither of these drugs cause cystitis, that urinary tract infection feeling, they could be given one right after another without any kind of problem with tolerability.
It's a miracle to me. He saved my life and what he was doing, and he didn't have to do this, but he did it because it mattered to him and he wanted to impact the quality of lives of other people.